John Rudan. I'm an orthopedic surgeon working in Kingston at the Kingston General Hospital, Hotel Du Hospital. I'm a professor at Queen's University. I'm head of the Department of Surgery here at Queen's. Most recently, we've been involved in a process looking at regionalization within the LHIN, looking at this not just from a surgeon's view of the world or even a hospital's view of the world. It's looking at our regional LHIN's responsibility of providing health care for all surgeons and surgical services within the LHIN. Our task is to provide the best possible and optimal care for our patients, but to do it within the financial constraints and realities of the life that we live in. In order to do that, we need to take a look at ways of finding the best of each institution and bringing that into the equation, and to try to reduce duplications, to try to reduce areas where there can be optimizations, so we can use our resources in the most appropriate ways to provide the care that we need. What I believe we can do, and I think we can do better, is that we can make use of many of the modalities that are available. We have CT scans in Perth Smith Falls. We have CT scans in Belleville. We have MRIs in Belleville. We have resources that are a little closer to the patients in those regions. They don't have to come to Kingston to get all the tests. They could get some of those tests done here in those other institutions, closer to home. We can coordinate that. We make sure that those tests, when they're done and done closer to home, can be immediately available to them when they come to the key visits. Those are the kinds of things that we want to have available. As well, when we do this, as we become much more integrated, as we are attempting to with our colleagues in the cancer care programs, we are trying to bring one-stop shopping together as much as we can for the patients, that we can have multiple visits reduced when they're seeing their surgeon, their oncologist, and their radiotherapist in the same location. These are really time-tested ideas. These are ideas that work. We've seen them in our own region. We've seen them around cardiac care for patients that require complex cardiac surgery and surgical procedures. We see that working very well. We see this in other regions in our province where these types of services, where we get the coordinations regionally performed, they work well. So we're not making this up. We know that it can work. What we don't know and what we need to learn is we need to learn how to do that here. I believe we've got the right people to do it. I think we've got the right forums in which we can try to bring those things out, and our challenge is to make it happen. One of the ways that we wanted to reach out is to do what we're doing today, to provide an opportunity for people to get information about what we're doing, and to provide a way of getting them to get their information to us. And one of the ways that we've looked at this, even just at the present time, is we've reached out to their hospitals, because hospitals are their own organizations, but they also have a public input into those hospitals. And that's an obligation that they have to reach out in their region to get their public response. This is really what we want to do, is to engage, help our region engage at the grassroots level, not just the people that are providing the care, but at the grassroots level, to provide their understanding of what they need, what they want, and how they would like to see their future in healthcare look.